Bismillahirrahmanirrahim. Welcome to my channel. Today in this video I am going to teach you the lymphatic drainage of the upper limb. Before we come to learn the lymphatic drainage, we must know what is the term lymphatic and what is the term lymph. So when the excess tissue fluid, which includes tissue fluid such as the plasma proteins and the cellular debris, travels within the lymphatics, it is called as the lymph. This lymph is filtered by the lymph nodes, and this filtered lymph is then drained within the venous system. And after this drainage, the lymph is drained into the venous system, and then it enters the right atrium of the heart, and then further processing it enters the lungs, and then there is the oxygenation of the blood. So that is all about the. And what are the lymphatics? Lymphatics are actually the blood vessels of the lymphatic system. We have done this before within the playlist of the general anatomy. You can watch it. We will cover the lymphatic system of the upper limb within the two topics, that is the lymphatics of the upper limb and the lymph nodes of the upper limb. So before we come to learn the lymph nodes, we must understand what are the lymphatics. The lymphatics are divided into two categories, that is the superficial lymphatics and the deep lymphatics. Superficial lymphatics follow the superficial veins, whereas the deep lymphatics follow the deep veins. So now let's see the course of the superficial lymphatics. Superficial lymphatics, as the name indicates, superficial. And what's the superficial? It's the skin. The superficial lymphatics drain the lymph from the skin and the subcutaneous tissue. The superficial lymphatics begin from the lymphatic plexus, then converge to form the vessels, to form different lymphatic vessels. And some of the lymphatic vessels travel along the basilic vein, and some travel along the cephalic vein. So those lymphatic vessels which are traveling along the basilic vein, how they travel like its shadow. Here is the basilic vein going, and alongside accompanying is the lymphatic vessel. Those lymphatic vessels which travel along the basilic vein, they drain the cubital lymph node. Where is the cubital lymph node located? It is located medially to the vein, medially to the basilic vein, and proximally to the medial epicondyle of the humerus. Then it travels within the arm, and then it drains within the axillary nodes. Axillary node have the different types, and the type which is drained by the basilic vein is the lateral axillary lymph node. So now we come to the cephalic vein. Those lymphatic vessels which travel along the cephalic vein travel further, cross the arm and the shoulder, and ultimately drain within the axillary lymph nodes. And the type of the axillary lymph node drained by the cephalic vein is the apical axillary lymph node. So that was all about the superficial veins. So now let's see the course of the deep lymphatic vessels. The deep lymphatic vessels follow the major deep veins. And what are the major deep veins of the upper limb? It is the radial vein, ulnar vein, and the brachial veins. We have learned them before. If you have not watched those videos, you can watch them within the playlist of the blood vessels of the upper limb. The radial vein and the ulnar vein travel within the forearm, whereas the brachial vein travels within the arm. And the lymphatic vessels following these major deep veins travel and terminate and drain within the axillary lymph node. And the type of the axillary lymph node drained by these lymphatic vessels traveling along them is the humeral axillary lymph node. Humeral axillary lymph node gets the excess tissue fluid drainage, gets the lymph drainage from the joint capsules, from the periosteum, from the tendons and the muscles. So that was all about the lymphatics of the upper limb. Again, a small review. The lymphatic drainage of the upper limb is studied under two topics, that is the lymphatics of the upper limb and the lymph nodes of the upper limb. Lymphatics of the upper limb are divided into two categories, superficial lymphatics and the deep lymphatics. And further, the lymph nodes. So now we come to learn the lymph nodes of the upper limb. The lymph nodes of the upper limb are found mostly within the axilla. The axillary lymph nodes are divided into 5 major groups. So to understand these 5 major groups, let's see these groups one by one. The first of all, we have the pectoral group, which is also called as anterior group. At the number 2, it's the subscapular, that is the posterior group. Humeral is the lateral group. Then there is the central group, and then there is the last group, that is the apical group. And all those nodes empty within the apical lymph node. So let's see these nodes one by one. Pectoral. Pectoral group. It includes 3 to 5 nodes. It's located within the medial half of the axilla and it receives the lymph from the anterior thoracic wall and the breast. At the second number is the subscapular group. Subscapular group includes 6 to 7 nodes. It's located along the posterior axillary fold and along the subscapular blood vessels and gets the drainage from the posterior thoracic wall and the scapular region. Then there comes a humeral group. Humeral group includes 4 to 6 nodes and it's located within the lateral wall of the axilla and it's posterior to the axillary vein and receives lymph from the deep veins of the upper limb. Then comes the fourth group, which is the central group. Central group includes 3 to 4 large nodes. It's located within the base of the axilla and receives lymph from the pectoral region, subscapular region, and the humeral axillary lymph node group via the efferent vessels. We have learned the humeral axillary lymph node. This group of 4 to 6 nodes, that are the humeral nodes. Humeral nodes drain within the central nodes of the upper limb. So now then comes the apical group. Apical group is located within the apex of the axilla. It receives lymph from the central axillary lymph nodes and the central axillary lymph nodes receives the lymph from the pectoral, subscapular and the humeral group. It means this apical group is receiving lymphatic drainage from all of the axillary lymph nodes. The group gets the drainage from the central axillary nodes via the efferent vessels and it also gets the drainage from the lymphatics accompanying the cephalic vein. And then where does the lymph from the apical group of the axillary nodes goes? The lymph from the apical group of the axillary lymph nodes is drained by the efferent vessels. Efferent vessels converge to form the subclavian lymphatic trunks. The subclavian lymphatic trunks, the left subclavian trunk is there and the right subclavian trunk is there. The right subclavian trunk drains within the right lymphatic duct, which drains into the right venous angle. Right venous angle is just at the junction of the subclavian vein and the internal jugular vein, whereas the left subclavian trunk drains directly within the thoracic duct. So that was all about the lymphatic drainage of the upper limb, which was the last topic of the upper limb. So next we will be doing thorax and some clinics of the upper limb. So keep watching this channel for more such videos. Allah Hafiz.